ACEs is an acronym for Adverse Childhood Experiences, and it's a real problem here in Oklahoma. There are 10 categories of ACEs, including physical, sexual, or emotional abuse, divorce, incarceration, substance abuse, and others. And the more of them a child experiences, the more it negatively impacts their ability to learn and socialize. In this week's InDepth, Susan Cadot and her guests explore what's being done to improve outcomes in Oklahoma.
All right, thank you so much, Rich. We are here with two experts in the field of working with children here in Oklahoma. I'd like to introduce them to you. First, we have Annette Jacoby, who is the director of the Oklahoma Commission for Children and Youth. And then we have Joe Dorman, who is the CEO of the Oklahoma Institute for Child Advocacy. I'd like to thank you both for joining us to have this important discussion today.
Thank you.
Thank you.
Annette, let's start with you. Tell me about the commission. What is it and what do you do?
So the Commission on Children and Youth was created in the early 80s as a residual of the large Terry D. lawsuit. It was a massive lawsuit in the state of Oklahoma where we discovered that children were not being well cared for, particularly in facilities and institutions across our state. So the commission was created to first and foremost, be an oversight agency and make sure that child serving systems are really taking care of children in the best way possible and that children are thriving. We have the ability to look into all kinds, private and public, child serving systems. And we also look for solutions. So we're not just all about finding problems and pointing them out and then walking away. We also want to help come up with solutions as well. So that's our primary purpose.
That's great. Joe, tell me about your organization, the Institute for Child Advocacy.
Well, OICA was created in 1983 at the exact same time as OCCY. We consider ourselves brother and sister organizations.
Yes.
That came from the Terry D. lawsuit. The creators of the entities realized that there needed to be oversight in government to ensure that the agencies were doing their job and have some teeth to that. But they also recognized there needed to be a voice outside of government as a nonprofit to speak loudly about children's issues, not only at the state capitol, but also to the state agencies to ensure that they're doing everything in the best interest of children. Since then, we've branched into being a voice at the national level through a collaborative partnership for America's children. And so we work to back up the work of OCCY and make sure policymakers understand these issues and try and provide that information and that data so they can make informed decisions.
Okay, we're here to talk to you both today to get some information about something that most people may not know is an actual thing, adverse childhood experiences. It's not just a description. It is something that the agencies like yours are very much aware of. It's a way of measuring what the future might hold for a child with ACE. What kind of makes up, Annette, an adverse childhood experience? Let's start with you.
Sure. So the original study, which was done in the 80s, really looked at three big buckets of experiences that an adult may reflect on in their childhood. And that's around emotional abuse, physical abuse, sexual abuse, having some kind of family dysfunction, being separated from a parent because of incarceration or divorce or death, having a parent with mental illness, or perhaps a parent who's been violently harmed. And in addition, just the whole idea of neglect, both physical and emotional. So this screening tool is really used to look at communities, right? So it's not a predictor. Because you have a high ACE score certainly does not mean that you are destined for some, inevitable struggles in life. But we do know that as a population, the more adverse experiences you have, the more challenges you're going to have to overcome. And or perhaps have to overcome. Mm-hmm. There are protective factors, Susan, and protective factors are so critical. And I hope we get to talk about those today because they're a way to mitigate these things. And that is so hopeful and makes us feel like there's positivity on the horizon.
We will talk about that, Annette. I want to talk to you, Joe, about why it's called the hidden epidemic. And part of me thinks, when you go into a household, the few things that are taboo to meddle with for the government are the parent-child relationship. Is that why this has been called a hidden epidemic? Is it really an epidemic, or is it just kids need to be tough with parenting?
It truly is an epidemic. And as Annette said, this was discovered back in the 80s. It actually was tied to a weight loss clinic where they were doing studies about why people's weight loss would fluctuate up and down. And they discovered that these traumatic events in a childhood often would carry forward into adulthood. And we realized that this trauma that's inflicted into children at an early age will result in long-term life and health issues. And so this epidemic, as what we've seen, and Oklahoma, unfortunately, has set the standard. Not only are we a top 10 state when it comes to ACEs, we are #1 in the nation for multiple adverse childhood experiences that impact children. We've been very thankful that the First Lady, Sarah Stitt, and others have been working to raise awareness about this. There was a task force that was created that Annette is a co-chair of that is working to try and find solutions within state agencies to try and work to overcome these ACEs and get kids the help that they need. And I know we'll talk about some of those solutions later, but this hidden epidemic, it really has impacted Oklahoma. It explains why we were #1 in the nation for incarceration, why we've been there at the top for heart disease, for obesity, and other issues. It all makes sense. And we've been fortunate to do the work at the Capitol to raise awareness with lawmakers where they now understand this.
I do want to read something to you here, some notes here from Tracy Hutchinson, who has a PhD in psychology and is from Fort Myers. The field of neuroscience, she says, helps explain brain dysregulation in childhood. The more stressful events in childhood, the higher correlation to potential structural changes actually within the brain. She goes on to talk more, but folks can research this more, the actual impact of childhood trauma on the brain. And as we look at this just in general, now we add the stress of COVID, parents with financial problems as they lose their jobs, not going to school. Joe, how does COVID factor in? Is it having more of an impact?
It absolutely is. One of the strongest factors for reporting child abuse and neglect is when that child is in the classroom. Teachers or school personnel will recognize those issues. And we've lost out on that with children learning virtually or having dropped out of school completely. And that's one of the issues that's not being talked about. A lot of these kids have dropped out of the educational system completely. OICA, other organizations are very much in favor of trying to get kids back in the classroom during this pandemic, but only if it's safe for the teachers and the students, and then the students not carrying COVID home to their family members. Oklahoma is 9th in the nation for grandparents raising grandkids. So we have so many different factors tied in with COVID-19. One of the biggest issues we need to address is counseling. We've been working with lawmakers to try and increase the level of school counselors. And these are the actual counselors that are trained in the profession, know how to deal with these traumatic events. The recommended number is 250 students per counselor. Oklahoma is in the low 400s. The national average is 472. So we are actually better than the national average when it comes to school counselor ratio, but we need improvement there, especially during this pandemic.
Annette, this sounds familiar when we talk about the lack of attention to mental health care, not just for children, but for adults who need it. And then we see the source of social unrest when we have shootings and we have the homeless problem. Again, we get back to that cycle, right? Why can't we have more counselors for our children when they need it most?
Well, that's the golden question, right? Why can't we? My guess is it's resources, resources, resources. Where are our priorities and what do we decide to fund as a state? And, that's just the challenge. We have a finite amount of resources to dole out for what we consider core services. And we also have a very generous philanthropic community that I believe contributes a wealth of good to our social service industry. But again, we need a constant source of funding for mental health. And I think you bring up an excellent point, Susan. Healthy children come from healthy parents. And so, you can beef up all you want in a childcare setting and in a school setting, and they can have some really fine, wonderful hours in a day. But we also need to make sure that when they go home, there is food and security and a nurturing environment. And that comes when parents feel like they can provide that they have the emotional and economic stability to provide that to their kids.
Susan, can I add on something there too?
Yes, please.
There are legislative solutions that certainly can happen, but a lot of this is already out there. And this is one of the great things that the Trauma Informed Care Task Force has looked at. One of the solutions that's working its way through the legislature this year is a bill filed by Sherry Conley to try and partner with some of those existing services out there. The Youth and Family Services programs have counseling built into their system. The problem is the school districts and those youth service organizations haven't been matched up together. There is legislation that's working to try and improve that, where there's an existing counseling service in a rural area, they should be partnered up with that school district. Likewise, we have places like Variety Care that offer counseling services. So those federal qualified health centers certainly can provide that aspect. Those are going to be some of the things we're looking at addressing in a very cost-effective manner that will provide that counseling. The flip side, for years, the last several years, we've had some lawmakers who are trying to increase school suspensions and punishment rather than get the kids the counseling services. OICA has been working against that. Oklahoma has actually been one of the leaders in the nation as far as not suspending young children. And we have bills that have been filed that are trying to increase the age, I should say decrease the age down to preschool. It's unacceptable to suspend a preschooler when they instead need counseling. And so OICA is working with lawmakers to understand that. We want to make sure that those lawmakers understand counseling will help these kids. Suspensions put them in the pipeline to prison. And that would be devastating for future generations.
So we are going to step into a more positive aspect of this. And Joe, I'm going to start with you. What would you like to see happen in the future to address this issue? Because I think acknowledging you have a problem is usually the first step, right? And is Oklahoma acknowledging that?
Yes, and that's been one of the great things. It started under Governor Fallon's administration. We were up into the 10,000 range for foster kids in the system. We're just under 8,000 now. So the progress that's been made through the two administrations focusing on this, the work that's been done on the Pinnacle Plan, with what we're seeing as far as changes in the system and greater understanding of ACEs. And I want to add on, we just had a huge win at the federal level with increasing the funding for the Chafee program that will help with those kids who are aging out. OICA worked at that, the federal level. Mark Wayne Mullen was one of the champions of that in Congress. We are going to see some good opportunities there. Funding is coming. The state agencies understand this. Director Justin Brown has had a focus on this. I'm confident we're going to see better opportunities because we have those leaders who are willing to make those changes. We do need foster parents, just like Annette said. We've got some great people out there who are serving as foster parents at all levels. And we need those, especially for those kids that are dealing with traumatic issues. There are additional incentives that are available for the foster parents who take in kids with trauma, increased counseling services. But we need those understanding parents who are willing to take on that challenge.
Annette, you said earlier there are some positive things going on. Now's the time. Tell us about that.
Well, I just have to tell you, I am so proud of our state. Oklahoma long ago adopted the idea of implementing best practices and evidence-based programs. We really were an early adopter of that in the 90s. And because of that, I think that what we have seen is when the economy was good and the government was able to invest in these programs, we saw a huge uptick in social services that were preventative. And that's what I really want to talk about, this idea of creating community shops, the Hope Centers that DHS and the State Health Department are rolling out, these places where all families, you don't have to be tagged as a family with a struggle or a challenge. If you need assistance with diapers or you want to learn about what to do with your biting toddler, that there's a place that you could go for healthy, happy, positive interactions. We do not want people to have to be on the doorstep of child welfare in order to get help. And I think Oklahoma has this really great patchwork quilt version of supports and services. Our problem is they're just not available everywhere. So it's a matter of connecting them and getting resources to those places where there's a desert.
So how long does something like that take? I mean, we need help now. Joe says we're number one. We're in a place where we don't want to be number one.
So Joe, I think the question is, it could take a while, right? Because we're trying to figure out where those services are needed and then where the funding is going to come from. And I want to be clear, there are roles for the general citizen to play in preventing child abuse. And that can be donating the clothes of your child when they get, they outgrow them to a resource that can hand those children's clothing on. Something that simple can be so useful. And then there are roles where we need super, super highly skilled professionals to work with folks to change behavior. And that's where it costs more in the upfront, but it saves us a lot of money in the end. And that's where we struggle, is investing in those kinds of services.
If there are citizens who care and want to help, professionals who care and want to help, pro bono to improve the lives of children, who do they call? Do they call you guys? Do we have to wait on a bill to be approved in the legislature?
Oh, no, they certainly can call Joe or they can call me, and we can connect them with an agency or an outfit that wants to utilize their services. Absolutely. There is truly, Susan, a place for everyone in this state to assist with the prevention of child abuse and neglect.
Oh, and I can give you a perfect example of something that happened this morning. I received an email from a woman in Norman who wanted to donate a suitcase because she heard that foster kids oftentimes have to pack up their belongings in a trash bag. One person wanted to donate a suitcase. The Citizens Advisory Board in Norman, right there locally for her, does things like that. And we are working to try and create a network and a directory of services. This is something that's happening with the Be a Neighbor program in DHS. It's something happening with the Count Me In for Kids collaborative in Oklahoma City. OICA publishes a desktop calendar with 365 different programs, one recognized each day. We're trying to raise awareness of those great programs that are out there working to benefit kids. And it simply just takes getting on the internet, doing a little bit of a search, go to our website and look at the directory of services that are available and get involved. The first step is deciding that you want to be a part of the solution. And that's what we do with advocacy. We also work to try and train people about the process, educate them about how to be influential at the Capitol. It takes one person voting and speaking up. As a former lawmaker, I can say on the bills that were filed, we heard maybe a comment or two about 5% of the bills that were actually filed. Lawmakers need to hear these stories from their constituents about what is going on in their lives so they can make the right decisions.
I'd like you guys to share a website for folks that they might be able to go to act upon what they've learned today. Joe?
I encourage people to go to our website, which is oica.org, or look for us on social media as the Oklahoma Institute for Child Advocacy.
Our website is ok.gov/OCCY, and we have resources available as well.
All right, I'd like to thank you both for sharing your insights with us today, and I know it'll make a difference in the lives of our Oklahoma children. Thank you very much.